As we prepare to mark World Food Day on October 16th, escalating obesity rates and unhealthy eating habits make it clear that it's not only about fighting hunger. South Africa has the highest rates of obesity and non-communicable diseases rates in sub-Saharan Africa, which also impacts on productivity and increases absenteeism. It's against this backdrop that the Water Research Commission, or the WRC, together with its partners, the Department of Agriculture, Forestry and Fisheries and the Agricultural Research Council, will hold a dialogue as part of World Food Day celebrations. The Food and Agriculture Organization is calling for action across all sectors to make healthy and sustainable diets affordable and more accessible to all. Well, joining us now is Professor Sylvester Mpandeli from the Water Research Commission. He joins us on the desk now. Good afternoon, Prof, and thank you so much for your time on the SABC News Desk.
Good afternoon to you and to your listeners.
Prof, well, one study is saying that obesity costs our economy right here in South Africa 700 billion rand annually. Now, that figure is indeed worrying. How did we, as a country, as a nation, as South Africans, reach this point?
I think there are several factors that we need to look at. Some of those factors is due to the fact that some households can't access high nutritional food.
Right, so it's a question of affordability
and
availability
and accessibility, yes. Right. So as a result of that, Water Research Commission, together with its strategic partners, as you have highlighted,
yes,
we are trying to raise awareness and also to share the results that we have generated through our research and development activities, so that communities are aware about the challenges that we are facing with regards to obesity, poor nutritional food and so on. And as a knowledge generation organization, we are driving these research and development activities across the country, so that households or community members are aware about this. And each and every project that we complete, we make sure that we go back to those communities and give them feedbacks about our outcomes.
Yes.
Over and above that, we also make sure that we develop it's either policy or ministerial brief based on the findings or recommendation from those projects. And I do believe that it is not only the responsibility of the Water Research Commission or the responsibility of government. This is about teamwork. That is why we are partnering with the various organizations, including the Food and Agriculture Organization at international level, and nationally we are working with universities, science councils and NGO to address some of those challenges.
It really sounds that this has to be a cohesive effort for us to reach our goals. What is your research or your findings showing us, Prof, when you do that sort of work in communities? How aware are people on the ground of what a healthy diet should look like?
Look, our research findings, varies from province or areas to area or communities. Yes. But the bottom line is that our community members or households are facing multi-stresses. And this is also influenced due to high climatic variability and change.
Yes.
And it's also influenced due to affordability of certain food. But what we are trying to do is
it's our poorer communities that are being hit the hardest.
Yes, they are the victim of this. But we should also understand the fact that some of us, especially middle classes, who are fortunate enough to access high nutritional food, we tend to change our lifestyle, our diet requirements and all those kind of things. Those who are in deep rural areas who can't afford it, the message is that instead of going to the market and buy stuff, why don't you establish your own backyard garden to produce different vegetable crops and so on. We are saying this based on the fact that Water Research Commission also has got a school-based project around Mamelodi. And the findings that are coming from there are very interesting.
Tell us.
it's not about producing, vegetable crops, but we are also trying to change the mindset of those kids to say, you can take agriculture as a career.
Yes.
You can be, a full-fledged commercial farmer. And we are interacting with those schools. We are planning to roll, that program all over in Gauteng province and also in other provinces in the country. But the bottom line is that we need to encourage our people to take high nutritional food, and they need to
also
produce
to
on
take
their own.
personal responsibility about what we actually put into our mouths in terms of the food we choose to consume.
Yes.
All right, Doctor, we're seeing obesity rates soaring not only in developed nations, but also in our lower income countries as well, where we have a situation where hunger and malnutrition are actually coexisting with obesity. So it's starting to feel like it's really a battle on two fronts now.
Yeah, it's correct.
All right, so the latest stats tell us that, it's quite worrying that non-communicable diseases kill 41 million people globally each year. That's equivalent to 71% of all deaths globally. What are some of the risk factors that we are looking at when it comes to obesity?
For example, if
because
one is not taking
it's
care of...
starting to feel like obesity is the main driver of NCDs.
Yes, but the bottom line is that if you're not taking care of yourself, you might experience, some of the chronic diseases.
Yes.
And for us as Water Research Commission, with our key strategic partners, for example, University of KwaZulu-Natal, we have got projects that focus on indigenous crops, like black jab, lab crops, and all those kind of things, so that our community will be able to access nutritional food.
Yes.
And it has already been proven by Agriculture Research Council, for example, to say some of these indigenous crops are rich in nutrients. And our community members need to take advantage of that. Over and above that, those indigenous crops, can also be commercialized and create job opportunities in those different communities and so on. So we need to send a very simple, straightforward message to those communities.
Yes. When it comes, currently our country is the only one in the region to have a tax on sugary drinks, all right? From your research, is there ever any evidence that such taxes actually curb obesity in the region or in the country, Professor?
I wouldn't say that because we have not yet reached at that level. And I guess, there are experts out there who can give you, a correct answer. From our side or our perspective, we are focusing more on agronomic crops, so that, our people can be able to access, good food, can also be able to use some of those food in order to generate income and so on. With regards to the sugar tax, I think I will leave it to other experts to entertain that.
All right. In terms of communities growing the crops you're mentioning, what would you like to see happen from government side? How should they be investing in such projects in nutrition? And what should the policies look like to provide these healthier, more sustainable diets going forward?
Look, what we need to do, firstly, we need to identify key strategic partners that can assist all knowledge generations organizations, like Water Research Commission, Agriculture Research Council, CSIR, and so on, to make sure that whatever knowledge that we have gathered so far, that knowledge is being executed or implemented properly, and the same knowledge that we have generated, it should also be able to assist policymakers, so that they can be able to develop policies or strategies or plans that are addressing issues on the ground. For us as Water Research Commission, we are proud about the fact that almost all our projects they address the science policy interface. And we try by all means to identify partners who can implement some of the outcomes from those projects. So this is about partnership. We generate knowledge, we manage it, we identify strategic partners for implementation, and then we do the monitoring and evaluation, trying to see if the situation is changing on the ground.
Yes. Is it changing in some communities? What kind of feedback can you give us?
In some areas, yes. But you also need to understand that this is a process. And sometimes we need to wait a little bit because some of us, we are operating at different levels. And then if you go to those, deep rural communities, yes. You start talking about, no, you need to eat a lot of moroho and all those kind of, they look at you and say, but where are you coming from? I'm saying this based on my experience. I mean, yes. I'm from rural areas. I know we've been eating moroho, mopani worms and all these kind of things. And this is something that we also need to partner with, for example, Department of Health. So that, it's not only about eating, healthy food, but you also need to have an opportunity to exercise and make sure that you understand the consequences if you don't take care of yourself.
Yes. Professor, thank you for sharing your thoughts with us right here on the SABC News Desk. This is Professor Sylvester Mpandeli from the Water Research Commission joining us right here on the SABC News Desk this afternoon.